Unit 14. Complete the table with words from C opposite. Put a street mark in front of the stressed syllable in each word. The first one has been done for you. No, exhaustion, adjective, exhausted. Noun, fatigue, adjective, fatigued. Noun, lethargy, adjective, lethargic. Noun, tiredness, adjective, tired. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of, sort, present with, put on, were on. Complete the sentences. Complete the sentences with the correct form of the verb present. Number one, a 67-year-old man presented with a 9-month history of increasing shortness of breath. Number two, the most common presentation is loss of consciousness. Number three, cranial arteritis may present as fever without any obvious causes. Number four, the patient usually presents with severe sore throat. Number five, the presenting symptoms in this patient could perhaps be due to renal failure. Number six, other conditions with a similar presentation include acute cholecystitis. Number seven, reduced blood in an important presenting complaint of celiac disease. Number eight, 2 months following presentation, the patient was able to walk. Read the patient's description of her symptoms to complete the case report. Look at the opposite to help you. I was well until a few months ago. In a beginning, I just feel off color and a bit tired. But lately, I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. Case 15. A 50 years old housewife who has been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight in the year before. She presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall out. Unit 15. Find word in the box with opposite meanings. Look at the B and C opposite to help you. Adequate, inadequate. against, for, insidious, sudden, likely, unlikely, severe, mild, rare, common. Make word combination using a word from each book. Look at B and C opposite to help you. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing vibration sense. Complete the sentences. Look at A, B, and C opposite to help you. 1. 39-year-old man present with a history of progressive abdominal distension over a period of 6 months. Number 2, bleakness may be caused by vitamin A deficiency. Number 3, the bleeding and purpura are caused by abdominal platelet. Number 4, the white cell count is normal, so we can exclude acute leukemia. Number 5, the yellow color of her skin and conjunctiva is probably due to jaundice. Number 6, there was a palpable mass in the right upper quadrant of the abdomen. Number 7, treatment is an augment of restoring fluid balance with adequate intravenous fluids. Number 8, the anemia may be due to increased red cells breakdown. Complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly. So he then have the typical insidious onset. He doesn't have any skin pallor and he doesn't have symmetrical paresthesia are absent. Vibration sense and I can feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflated or sore. Unit 16. Label the diagram using words from the box. Look at A opposite to help you. Number 1, school. Number 2, jawbone. Number 3, Spain. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number 7, shoulder. Number 8, thigh bone. Number 9, kneecap. Number 10, shin bone. Mark the types of fracture 1 to 5. With the description A to E, look at B opposite to help you. Number 1, open to letter E. There is a break in the skin. Number 2, communicated to letter C. The bone is broken into several pieces. Number 3, displaced to letter D. The broken pieces are separated. Number 4, green stick to letter B. The bone is bent in occurs mainly in children. Number 5, impacted to letter E. The broken pieces are pushed together. Complete the textbook struck. Look at C opposite to help you. reducing. A fracture involves strain to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to malunion. Unit 17. Complete the table with word from A and C opposite. 10. Complete the sentences with word from the table. Verb, delay. Nouns, delay. Adjective, delayed. Verb, develop. Nouns, development. Adjective, develop, developing. Verb, distant. Noun, distension. Adjective, distended. Verb, fail. Noun, failure. Adjective, failing. Verb, nourish. Noun, nourishment, nutrition. Adjective, nourished. Nourished. Number 1, babies with fetal alcohol syndrome may present with failure to thrive. Number 2, abdominal distension may be due to an enlarged liver. Enlarged liver. Number 3, small amounts of alcohol in a pregnancy can affect fetal development. Number 4, mortality from measles can be reduced by better nutrition. Number 5, delay in one or more of the milestones may be the first signs of disease. Complete the sentences. Look at A and C opposite to help you. After sitting, babies learn to crawl, and then to walk. Number 2, a child who has started eating solid food has been weaned. Number 3, someone who is not very tall is said to be of short stature. Number 4, the stage in a child's development are known as the milestones. Number 4, a child who is beginning to develop sexually has reached puberty. Write the common English name for each disease using your medical knowledge. Number 1, enlarged parotid glands, MOMS. Number 2, difficulty opening the mouth, lockjaw. Number 3, rash and enlarged posterior occipital nodes, German measles. Number 4, paroxysmal cough with vomiting, whooping cough. Number 5, pupils and vesicles, first on thorn chicken pox. Number 6, cold and cool followed by rash measles. Number 7, sore throat and rash scarlet fever. Number 8, swollen joints and a heart murmur. Rheumatic fever. 9, fever followed by muscle weakness, polio. Number 10, come with Strider group. Unit 18. Complete the table with words from A, B, and C opposite and related forms. Put a straight mark in front of the stressed syllable in each word. The first one has been done for you. Verb inhibit, noun inhibition. Verb produce, noun production. Verb release, noun release. Verb replace, noun replacement. Verb secrete, noun secretion. Verb stimulate, noun stimulation. Complete the passage from a textbook. Using the illustration and your own knowledge, look at the opposite to help you. Pulses on GnRH, gonadotrophin releasing hormone, are released from the hypothalamus and stimulate LH and FSH release from the pituitary. LH stimulates testosterone production from Leydig cells of the testes. Testosterone feeds back on the hypothalamus pituitary to inhibit GnRH secretion. FSH stimulates the circuitry cells in the seminiferous tubules to produce mature sperm and inhibits A and B. Inhibiting causes feedback on the pituitary to describe FSH secretion. Complete the sentences. Look at A and C opposite to help you. Number 1, a diffuse change affects many parts of an organ of plant. Number 2, localized change affect only on part. Number 3, his diet deficient in iron. She doesn't get enough iron. Number 4, excess. T3 and T4 increase the basal metabolic rate. Matt Mrs. Davis symptoms 1 to 7 with the question here. Doctor asked A to G. Look at the opposite to help you. Diarrhea to letter D. Are your bowels normal? Number 2, eating more. To letter C, what is your appetite like? Number 3, heart intolerance. To letter A, do you prefer hot weather or cold? Number 4, overactivity. To letter E, are you able to sit and relax? Number 5, palpitations. To letter G, have you ever felt your heart beating rapidly or irregularly? Number 6, weight loss. To letter B, if you weight steady. Number 7, tremor. To letter F, do your hands shake? Unit 19. Complete the table with verb from B opposite to help. Opposite and related forms. Verb accommodate, noun accommodation. Verb constrict, noun constriction, adjective constructor. Verb converge, noun convergence. Verb dilate, noun dilatation, adjective dilated. Verb droop, adjective drooping. Verb oscillate, noun oscillation. Verb react, noun reaction. Match the pictures. 1 to 6 with the condition A to F. Look at B opposite to help you. Letter A, dropping of limbs to number 1. Number 2 to letter C, irregular pupils. Number 3 to letter B, dilated pupils. To letter number 4 to letter F, constricted pupils. Number 5 to letter D, cataract. Number 6 to letter A, to letter E, dropping of lids. Complete the extract from a textbook. Look at the opposite to help you. Retinoscopy, examine the retina with an ophthalmoscope. Is possible with the pupil dilated to obtain the maximum view. Look for papilloedema and for flame shade hemorrhages and a cotton ball exudes. Assess the state of the arteries and note the presence of any narrowing as well as nipping at arteriovenous crossing. Unit 12. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with slate pallor. She was not obviously dehydrated. The temperature was 38 degrees Celsius. Pulse 100 mean blood pressure 180 millimeter of mercury. Examination of the rest of the cardiovascular of respiratory system was normal. The abdomen was not distended. There was generalized tenderness. Weight was most marked in the right lower quadrant and was associated with guarding, not rigidity. There was no rebound tenderness and no measures. We felt bowel sounds we reduce. Match the description of the stools 1 to 6 with the condition most likely to cause them A to F using your medical knowledge. Look at B opposite to help you. Type of stools. Number 1, loose, blurry. To letter C, ulcerative colitis. Number 2, loose, pale, bulky. To letter E, celiac disease. Number 3, clay color. 2, letter F, obstructive jaundice. Number 4, black 30. 2, letter A, gastric ulcer. Number 5, small heart. 2, letter B, irritable bowel syndrome. Letter A. Number 6, clear watery with mucus. 2, letter D, cholera. Math fractures 1 to 7 to the doctor's question A to G. Look at B opposite to help you. Number 1, blood. Have you faced black stools? Number 2, bowel habit. You often do you open your bowels? Number 3, change in bowel habit. Are you going to the toilet more often than normal? Number 4, bulk. Is the size of the amount of the stool normal? Number 6, consistency. Are the motion hard or loose? Number 7, offensiveness. To letter D, do the motion have an usual smell? Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Unit 21. Write a simple 8 phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Distinction number 1. Hysterectomy, surgical removal of the womb. Menorrhea, heavy periods. Salpingitis, inflammation of one of the tubes that connect to the ovary to the womb. Number 4, cervical biopsy of small piece of tissue removed from the neck of the womb. Read the conversation between the gynecologist and the patient and see opposite and complete the notes about the patient. Menarche, 12 years. Menstrual cycle, 4 to 5 in a 28 cycle. Menorrhagia, no. Last menstrual period, 50 seconds ago. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little white discharge. No, write the question that the doctor asked. Look at the opposite to help you. Menarche, how old were you when you started to get your periods? Menstrual cycle, are your periods regular? Are your periods regular? How long do the periods last usually? Last menstrual period. When was your last period? Menorrhagia, would you say they are light or heavy? Heavy, do you get clothes? Dysmenorrhea, do you get period pains? Discharge, if there any discharge between the periods, what color it is? Complete the case report. One word is needed twice. Look at B and C opposite to help you. Case 15. A 45-year-old women have been having prolonged periods lasting for 8 days, with the passage closed for 9 months. There was no bleeding between periods or often intercourse. Her, her periods were not particularly painful. She had not noticed any hot flushes or right sweats, and her general health and always been good. She had taken the oral constructive pills until a year previously, when a copper coil was fitted to had has a normal pregnancy when she was 25. Diaphragm, IUD, condoms, copper coil. Unit 22. Complete a conversation based on the case history in the opposite. Doctor, what seems to the problem? Patient, if been getting palpitations. Doctor, how long have you have 10? Patient, for about 6 months, but if had hair problems for years, with tiredness and shortness of breath. In the end, in cold walk more than 100 meters, what having to stop. I have to sleep on 3 pillows. I had a mitral valve replacement 3 years old, and that improved things for a while. Make word combination using a word from each box. Words can be used twice. Look at the B and C opposite to help you. At fibrillation, at rest. Atrial fibrillation, cardiac output, heart failure, on a 4, beating edema, premature beats. White, the word a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Dyspnea, breathlessness, arrhythmia palpitations, orthopnea, breathlessness when laying flat. 4, edema, swelling. Complete the case report. Look at A, B, and C opposite to help you. Case 13. 60 years old woman attended her GPS surgery complaining of breathlessness on exertion. This had been increasing over the previous 8 months until it was producing problems at around 500 meters walking off the level. There was no history of chest pain. She had several episodes of fast palpitation with lags 20 to 30 minutes and were associated with some shortness of breath. She had notice some swelling of the ankles by the end of the day. This disappeared overnight. Unit 23. Complete the table with words from A opposite. Put a street mark in front of the street syllable in each word. The first one has been done for you. Verb, auscultate, noun, auscultation. Verb, examine, noun, examination. Verb, inspect, noun, inspection. Verb, palpate, noun, palpation. Verb, percuss, noun, percussion. Put the step for examining the heart and circulation in order according to the four-stage system. Look at A opposite to help you. Measure the heart side, percussion. B, are there any murmur? Auscultation. Feel the radial pulse, palpation. Look for clothing, inspection. Locate the apex, breath, palpation. Not any thrills, palpation. A doctor is presenting the case of 43-year-old woman at a meeting in the cardiology department. Complete the test of her presentation. Look at B opposite to help you. On examination, he was parexial with a temperature of 38.5 point. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 138 and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present as there was no central or peripheral cyanosis. Her apex bed was displaced to the anterior axillary line but still interfere intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that they had been systolic and main diastolic. Murmurs heard best and the apex. When she was examined some heard later, there was a harsh pericardial friction run all over the precordium. Our diagnosis at that time was our mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Unit 24. Match the two parts of the sentences. Look at A, B, and C opposite to help you. 1988, the UK launch of live attenuated. Number 2, chickenpox, varicella is a common infection. Number 3, rabbit has rabies incubation. Number 4, the patient remained feeble. Number 5, she was admitted with a 4-day history to influenza type symptoms of fever with. Number 6, quite a proportion of patients who recover from hepatitis B. Number 7, the central part of Africa in the means of epidemic. Number 4, measles, rubiola is most. Number 9, Lyme disease is caused by transmission. Number 10, PUO stand for. Letter A, period ranging from 4 days to May months. Number B, rigors, myalgia and general malaise. Letter C, become carriers of the virus. Letter D, infection during the catarrh stage. Letter E, disease of childhood. Letter F of AIDS. Letter G of B, border ferry for animal to made by exotic things. Number H, with peaks of temperature of 39.5 Celsius degree. Degrees. E, pyrexia of unknown origin. G, measles, mumps, and rubella MMR vaccine. Number 1 to letter G, J. Number 1 to letter J, number 2 to letter E, number 3 to letter A, number 4 to letter H, number 5 to letter B, number 6 to letter C, number 7 to letter F, number 8 to letter D, number 9 to letter G, number 10 to letter E, A. Perdón, excuse me, number 10 to letter I. Complete the case. Report on patient in A opposite. Look at A, B, and C opposite to help you. Case 45. On examination, he looked unwell. His pulse rate 100 minutes. He has a palpable spleen. The combination of fever and rigors in the patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation periods usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentences. Look at A, B, and C opposite to help you. An infection which can be treated successfully with an antibiotics is curable. Number 2, another word for an epidemic is an outbreak. Number 3, bacteria and viruses and viruses are example or microorganisms. Number 4, someone whose temperature is normal is a favor. Number 5, the common infection with its Epstein-Barr virus is known as glandular fever. Thank you.